Dr. Davidhizar, I would like you to talk about arthritis. It seems to be definitely going around. What can you do? What can you do for it?
Well, there's several different kinds of arthritis. Actually, there's quite a few different kinds of arthritis. The most common one we think of with arthritis, of course, is rheumatoid arthritis. And there are some new drugs that work really well for that. We've had some really good results with patients in my practice. And that's kind of the arthritis comes in a lot of different forms, even rheumatoid arthritis. Some people have a bout here and there and then it's gone. Other people have the kind of rheumatoid arthritis, it's a crippling kind that just comes and never goes away and gets worse and worse and worse. Their hands get deformed. They're eventually in wheelchairs. That's the worst kind to have. But with the medicines we have nowadays, we can prevent a lot of those things from happening by taking these biologicals, medications. Most of them are injectable, but you can give them to yourself at home. It's pretty easy to do. And they actually stop the progression of the disease, which is what we're trying to aim for. Now, these people still have pain with it, usually, but the pain becomes much more tolerable, and they can function much better. They don't have the severe morning stiffness that they have with rheumatoid arthritis. And so there's lots of new options for that treatment. A lot of people have what we call osteoarthritis, and that's really from trauma, from working hard all your life, and from having a lot of wear and tear on your joints. Those people actually, the drug of choice for that is Tylenol or acetaminophen, and a lot of those people have really good results from that. Most people don't want to do that because they think, well, it's just Tylenol, it's going to work. But with the adequate doses, most people get pretty good results from that. If that doesn't work, then there's other things. If it's just one joint or certain joints, we frequently will inject them with different medications, which helps make the pain go away and decrease the inflammation. So there's lots of different choices for that. But the important thing with that is try to keep from, overusing certain joints that are causing you difficulty. That's sometimes hard because you sort of have to carry on with life. But so the much as you can do that, the better.
Okay. So basically the constant use of some joints will bring about arthritis?
Yes, especially if you had any injuries to those joints.
Especially if you had any injury to those joints. So overall today, just to summarize this, to make sure I'm getting this here and make sure the viewer getting it, you have medicines and you inject them, and that's kind of like the standard, the golden standard of treatment, or are there have I missed things and there's other things the person can do at home or should be doing and stuff like that?
Well, there's some exercises you do too that help quite a bit, but the new standard of care for people with severe arthritis, now people just have a leg and pain here, we don't do this for, but if they have rheumatoid arthritis especially, that's severe, the injectable medications have had a huge impact on their ability to function and to carry on a normal life.
And such a treatment, such an injection lasts how long? Weeks, months, years?
Depends. Some people take them every week, some people every 2 weeks, some people every 8 weeks. So it depends on how the patient responds to it and what the medication is. There's several different kinds of medications, and some are more frequent than others, but most of them it's not like you're taking a shot every day. It's at least every week or two. So it's a doable thing for most people.
I see. And that treatment can be kept up for years then? Because a person with 50 or 60 having arthritis, and if after a year the medicine wears off, that's not too good yet still. I mean, it's better than nothing for a year or two, but so you're saying it can be, kept up for quite a while?
It can. There's some side effects from the medicine sometimes, so we check their blood periodically and make sure they're doing okay. But most people tolerate the medicines very well. Mm-hmm. I've seen very rare complications from them.
Mm-hmm. Okay. Well, all right. Here you have it. So basically, going to a doctor, getting the new type of, and I don't know how new, but relatively new, the most modern treatment, the pain, because that's what it's all about. I mean, you can't lift a coffee cup, and maybe you can lift a coffee cup, but you can't lift your grandson, and that can be frustrating, I assume. You know what I mean? Stiffness in the morning, stiffness throughout the day. So anyway, it's the pain because it's the life which doesn't function anymore. There's certain things you can't do. In most cases of those severe pains, you can get rid of.
True.
Okay. That's good. That's good news. That's wonderful. Because so if that is so, why do so many people, so to say, suffer? I noticed one guy at, is a Starbucks friend. I see him probably every 2 or 3 weeks, and ever since I know him for 15 years, he's suffering from arthritis, and he's just keeping suffering. He just doesn't. I don't know. Maybe he doesn't go to a doctor. What do I know? But the point is, he has always pain.
Well, he should go to a doctor and find out what kind of arthritis he has. You know, the rheumatoid arthritis is the one we use these drugs on. If he has osteoarthritis, they don't work for that, so we do different treatments. So, but that's usually not all your joints. It's only 1 or 2 joints that give you trouble, so it's much more treatable than rheumatoid arthritis is, where it usually affects all your joints.
Mm-hmm. Okay. All right. Good. So anyway, there definitely is hope and cure for just about everybody.
There is.
Wonderful. Thank you very much, Dr. Davidhizar.